Sian Savagan, the matron for Liss Garden, St Barnabas Community Hospital. So welcome to St Barnabas, and I'll take you on a short tour around the site. So as we come through, we have reception and general office there. And 2 consulting rooms. We've got a small consulting room and a large consulting room, and we have visiting consultants from Derriford Hospital that do clinics there and nurse-led clinics.
What sort of clinics happen here?
Gastro, diabetic, podiatry, speech and language. Should we come through? So this is a lift that we use for patients when they're transferred in, or for patients that need to have got disabilities that can't manage the stairs, so that go up to the top floor.
So can you fit a bed in that?
Cannot fit a bed in that at all. Only a patient's transfer trolley that we use from the ambulances. So if a bed's used in there, it has to be taken to bits, condensed down. So, okay. So we come up to the. So before we actually get to the ward, inpatient ward itself, we have a minor injuries unit in there. So we have no X-ray facilities on site. It's just a 1-bed minor injuries unit, which was opened from 9 o'clock to 3, Monday to Friday. Right. So that was staffed with the trained member of staff that looked after the 9 patients upstairs. Patient stay room. This is where they used to come. Here. Fantastic view for them. And then we come into the ward area itself. This is the nurse's station where the nurse would sit to look after the patients downstairs. So our first room we come to is Ward 2. So this used to home 2 male patients. Used to fit 2 beds in here. And it's now used as a children's services storage room throughout the community. So this would have 1 inpatient in this room. So obviously the doors are quite narrow to get a bed in and out. We wouldn't be able to get a bed in and out of this room. It would have to be all dismantled to come out. But it's now used as a podiatry clinical area. So this is Ward 4. But of later years has been used as our day case ward, because we have theatres. We had a day case theatre, so patients used to come here and recover post their operative surgery in there. So, but historically it was an inpatient unit, and we had about 4 inpatient beds in here. At present now our health visitors use this room, so they're located here. So in here we have our chapel that was on site, so it's used every year since the temporary closure for blessing of the cribs, and it's always been used for that. Which is a lovely building. And of course we've got St Barney sat in the chair. The chapel would have links to the site when it was originally occupied by the nuns working here, and they used to nurse patients. So this is a kitchen where the GSAs would prepare patient drinks, empty food trays, use the dishwasher, and they would also put, patients would have their names on the board here with any dietary requirements and who was in which bed, so they knew where to take their meals. And any relevant nursing clinical details that they would need to know. So now we go upstairs to the middle floor. This is where our female inpatients work. So that would have been clinical nursing stalls there, and the drugs trolley was kept there. And then going to Ward 5, which was a female day, which we have 3 patients in here. Historically, they had about 4 to 5 patients in this room, but the numbers got reduced due to infection control issues because we couldn't have beds near sinks. Lovely view for patients convalescing. So within Ward 5, it's quite a large open area, vacant area now, with lovely views, so we're looking at utilising this room in different ways. Then we come out of Ward 5. And we go into Ward 6, which was a single room. So we would use this room for any infection, end-of-life patients. And then we go into Ward 7. Which was a 2-bedded room. Again, historically, there used to be about 4 patients in this room, but again, due to infection control issues with the sink, they had to reduce the numbers down. But again, nice big space that could be utilised. So, toilet facilities for the inpatient ladies. Quite a large bathroom. And a small toilet. But again, as you can see, all the doorways upstairs and downstairs, we cannot get beds through the doorways at all. The beds need to be dismantled and moved. It's used as a clinical storeroom now, but historically, again, that was used as an inpatient ward. Previous to that, poorly babies were there.
Were they cared for by the nuns?
Yeah. So as we go back down into the middle floor, so this was the nurses' general office. So where the ward clerk sat and the nurses, and whiteboards for any discussions. And across the corridor was the ward manager's office. So staffing for the 9-patient embedded unit. So the ward manager was supervisory 5 days a week, and then we'd have 1 trained and 3 healthcare assistants on for the early shift, 1 trained and 3 on for the late shift, and 1 trained and 2 healthcares for the night shift. We increased the healthcare number at night due to fire, because trying to evacuate patients, you can see how difficult it would be, evacuation with the narrow corridors and the staircase.
So what's the space you've been used for now?
So the acute care at home, we've moved from the other end of the building, so in a small office, so they've moved over, so they accommodate the nurse's office, and the ward manager is the team lead for acute care at home. Okay, so we've had to be very careful of what patients we could nurse at St Barnabas due to the stairs, so we couldn't take any confused wanderers, quite advanced dementia, Alzheimer patients, so it tended to be those patients that were near to discharge, independently ready to go home, or end of life, bedbound patients. But we couldn't take the risk for the staircase. As you can see, there are quite a few areas of the building that do need attention on our estates team. So this was the theatre that was used for the day case. Surgery. As you can see, it's used for storage now for the health visitors, but there's a theatre trolley, scrub sink.
What kind of surgery took place here?
Plastics, hand surgery. And then this would be the prep room. And here to get the trolleys ready for theatre. So then we come to the main kitchen downstairs, where all the food prep took place. And then a cold larder to the side. So the food would be heated in the oven here, and then we would take it and it would go up on a dumbwaiter, which went up to the male first floor and the top floor for female patients. So food would go up there to each floor. We have the outpatient. So in this space, our community rehab teams are based here, occupational therapists and physiotherapists, so they would have in-reached to our patients up on the wards. Went and saw those, but that's their base here at the moment.
Do they get involved with clinics here now? Or?
No, they just run from outpatients. And then we have a very large room down here, which could be used as a gym for the patients. And we have, at the moment, there's a respiratory team, so we have lots of groups here. Respiratory use it quite a lot for their morning sessions or day sessions. And then we have an outpatient physio department right opposite, which is used Tuesday to Friday, busy outpatient physio. So that area again would be a really big space we could utilise for. We're looking at bringing other services in.
What services are available here at this point?
So at present we run clinics from Derriford and our nurse specialist services within CFT. We've got our acute care at home team that are based here, our district nursing team, the health visitors sit upstairs as well, and we also have children's services for out in the community. So they work from here.
Okay. So
We have GSAs on site that keep the site clean and up to standards. So there is potential going through the site. As you can see, we have lots of rooms that are vacant that could be utilised for other services to come within the building and support our community.